Well, I already have a passport and I use it to travel abroad. But apparently now I might need a health passport in the future just to get around and do regular life stuff. In China, this kind of system has already been in play now for a few weeks due to this virus.
In Hangzhou, to enter a tower block, you need to have your temperature taken and registered. And you must have an app on your phone into which you input your name, temperature, recent travel and ID number. The information generates a colour code.
In Hangzhou, to go out of the community or to public activities, you need to have a green code. This green, yellow or red code is automatically decided through the system. It uses big data to decide whether you've been to affected districts or come into contact with those people.
But what if you're well and get a red code anyway? This man says he self-isolated while visiting Anhui province near Wuhan and back home in Shanghai. But there's no way to challenge the technology.
Our office building here, you need to register. You need to show the code to demonstrate that you're healthy. So when I was red, there was no way I could go to the office and work. I didn't do anything. Then after 2 or 3 days, I looked and suddenly it was green. I don't know why, but I think that although it's not really reasonable, it is still a preventative measure.
VST Enterprises Limited, the UK-based cybersecurity firm, have developed a digital health passport, a platform, vHealth Passport, from their revolutionary vCode and vPlatform technology. vHealth, powered by vCode, not only helps rapidly speed up the process of getting key critical care workers within blue light emergency services returning to the front line, but also ensure that they do so safely and securely. A key worker can present their assigned vCode using their smartphone, fob, or lanyard printout, which can be scanned outside of the 2-meter safe distancing zone. This can present in-depth information to any healthcare official blue light service or a high-level GDPR-compliant screen to members of the public to confirm and authenticate their current health status visualized by a traffic light system, green, amber and red. Other uses of the vHealth Passport are private companies, airlines, hotel chains, and sports and leisure organizations that need a return-to-work passport for their employees and guests. So that's a lot of people who will need this digital passport system to do almost anything, it seems. It's just incredible that this is proceeding anyway, given how easy it is to investigate the truth about this virus from alternative news sources outside of the mainstream and discover that the data modeling behind the lockdown was nonsense. The death certificates are being manipulated, content about viable treatments is being censored on social media or flagged as misinformation, and recent studies have shown that the fatality rate is between 0.1 and 0.3%, and yet plans for more Big Brother control of the populace continues at pace nonetheless. If the population at large doesn't wake up soon and reject these unnecessary and draconian digital ID systems, they will become the new norm and our lives will never be free again.